A clinical pharmacist at the Greater Accra Regional Hospital has revealed some of her colleagues, for fear of contracting COVID-19, withdrew their services over the lack of personal protective equipment. According to Mami Rabana Ansa, health workers there felt unsafe and had to abandon some wards at the hospital. In today's episode of Multimedia's Save the Health Worker campaign, JoyNews' Henry Kwesibedu spoke to the pharmacist who blamed the situation on lack of PPEs.
As a clinical pharmacist, we work hand in hand with the doctors on the various wards. So virtually have some of my colleagues at the emergency and the various medical wards. And we realized that during the COVID-19 times, there were times when people come into the ward, you are not too sure their status, and by the time you realize the person has turned positive. So we realized that if we are not, at that time, we were not getting enough of the PPEs. So it was a bit scary knowing that you are exposed to patients and you are not really protected. So that was our main challenge. So in the beginnings, we had to slow down on some of our services because we had to make sure we are properly protected before we can go back working on the wards and all that. So that has been our main challenge with our work. Yes. I think currently we are still struggling a bit. For my colleagues who are at the main COVID center, that one it's a bit easier for them to get it. But for those on the general wards, there's still been a challenge on getting the PPEs you need to actually work on the various wards. So it's still not readily available for all the pharmacists. Yes, yes. Oh, there was a time because some of my colleagues would come and complain to me that I go here, everybody, the doctor is in the gown, and I'm the only one in my normal lab coat going. Eventually it's quite scary. Yeah, so we had to more, like as I said, withdraw a bit and see what we can do at a distance, because if I get very close and I get infected, I'm going to infect every other person in the pharmacy. So we had to readjust when it comes to some of our services. But as I said, with this donation, it's going to help us to go back confidently. Yes, confidently back to do most of the work we are doing. Yeah.
Thank you very much.
Thank you too.
Thank you very much.